All right, good evening. Thank you for joining us for the Hop on Board webinar series. My name is Carly. I'm a rising junior majoring in molecular and cellular biology, and I'm on the pre-dental track. And I serve as a member of the new student orientation core team. Tonight's session will cover the extensive services and resources available to all pre-professional Hopkins students, including pre-health and pre-law. We have a representative from the Office of Pre-Professional Advising here to share their knowledge and insight for your student success. All of the webinars in this series are recorded, and the recording will be posted on our website for a few days after tonight's presentation. You'll find the recording where you found the registration link. Throughout the webinar, please feel free to ask any questions using the Q&A feature at the bottom. We'll do our best to answer your questions after the presentation is complete. And if we're unable to get to your question, please feel free to email firstyear@jhu.edu. Now I would like to introduce Davina Colwell, the Director of the Office of Professional Advising.
Thank you, Carly, for that great introduction, and thank you all for joining us this evening. As Carly said, I am the Director of the Office of Pre-Professional Programs and Advising, and tonight we're going to talk about the different services and ways that you can support your students throughout this journey. So thank you again to the planning team for hosting this webinar, and I hope that you get a lot of really helpful information out of tonight's presentation. So an overview of the services that we offer. Briefly would just like to introduce our team. So we have really, I think, amazing advisors that we work with that really care about the students' progress and well-being. And we serve as often the first line of questions or inquiries, thoughts about entering into pre-health or into law. And so any students who are interested in going into health professions, that includes dental, medical, allied health professions, optometry, anything in the health professions, they can come to our office to start that conversation, as well as anyone interested in law. So we're located in Shriver Hall in room 030. And we are available for in-person and virtual appointments. That really is up to the student about how they would like to meet with us, but we do offer both options, as we also work with alumni as well. So a lot of our alumni who are applying to these programs are often no longer in the Baltimore area, and virtual appointments really do work well for them. But any student has the option to do in-person or virtual appointments. And also our website is located on here, and I think that will also be dropped in the chat. So our office really aims to support students through communication, providing resources, programming, and continuous assessment to serve the undergraduates and alumni pursuing a professional education and medicine, other health professions, and law. So what might that look like for you or for your student? So in the area of law, if you're interested in going to law school, we engage you in a number of different ways. So in the explore and prepare stage, we offer an opportunities newsletter that we send out bi-weekly that has different resources for you, from thinking about applying to law school, what that means, exploring those options, to visits from different law schools where you may want to hear about specific programs, to internships that are available, research opportunities that are specifically geared towards those looking to enter into law school. We also provide one-on-one advising appointments for law students, as well as drop-in advising. The difference being one-on-one advising is a set time for you to come and speak with a pre-law advisor for 30 minutes. Drop-in advising is more so if you have a quick question, we're there for an hour and you can come and drop into the room and ask your question. But both options are available, as well as contacting us through email. We also offer a pre-law workshop that goes over, provides an overview of what to expect as a pre-law student, thinking about what types of internships you might be interested in, your application timeline, things of that nature, things for you to be thinking about. Also, you'll want to create an LSAC account. The LSAC is essentially the governing body of law school admissions. And so it's the Law School Admissions Council. And so if you're thinking about going to law school, creating an account early is definitely a way that you can stay engaged in that space, even if you're not sure that you will ultimately apply to law school. If you're thinking about it, it's just a good organization to create the account with. We also have a Hopkins semester in DC that is run independently of the pre-professional office. It's its own separate office, but a lot of our pre-law students do take advantage of doing a Hopkins semester in Washington, DC, where a lot of them will work on advocacy and public policy and other issues that they may care about, with a class geared towards that particular interest. Also, internships and research opportunities are things that we promote through our office, and that we can also advise you on depending on what your interests are. When you get to the application stage, we provide law school admissions visits, so you can hear from specific programs, helping you with review with your personal statement by reviewing that personal statement, giving you feedback on that. We also hold applicant support workshops where you can hear from other Hopkins alum or Hopkins applicants to law school, where you can learn a bit more about that process from the student perspective. We also host virtual admissions visits as well as those in person, and we also work with our alumni. So if you do graduate from Hopkins, either the School of Arts and Sciences or from the School of Engineering, you still have access to these services after you graduate if you decide at that time that you would like to apply. So your next steps as a pre-law student. You can, starting in August, which is actually in a couple of weeks, but closer to when you actually start courses, you'll be able to make a pre-law advising appointment. There's nothing that you have to do prior to that in order to make the pre-law advising appointment. And if you've indicated that you've had an interest in pre-law, through the interest survey, we'll also add you to the listserv. If you have not, you can always reach out to us to be added to the listserv as well. All of those options are available on our website, which I do absolutely recommend that you peruse. Also, you can attend that pre-law overview workshop that will happen in the fall semester, and you'll likely get that date in a welcome email to pre-law advising. So we also advise students in pre-health. I will say that the largest group of students that we generally advise are those interested in going into medical school, but we also advise students interested in any area of health. So if you are not decided, if you're thinking about it, we're your first stop for information. So when we're advising pre-health students, we keep in mind where they are in that process, and really have broken it down into exploring the pre-health as an option, what that looks like for you as a student, as well as what that might look like for you in your future career. Opportunities to reflect, as the application process to health profession schools require quite a bit of reflection and self-awareness throughout the process. And then when you're ready to apply, we have a number of different support services to help you through the application. So in that explore area, which as you coming in as a first-year student, you're most likely in that area where you're exploring. You may have thought about things that you might like to do within medicine. You may have had some prior experiences, but you're looking to be able to gain more experiences and really solidify that this is the path for you. So we have the opportunities newsletter that we send out weekly once the semester starts. We do send it out monthly over the summer. This would be something that you are added to if you've expressed interest in that survey, asking about your incoming interest. And also you could join the listserv, of which we send this out just on our website. Again, you can visit our website to be able to do that. And we also have the opportunities newsletter located on our website. So if you ever just want to peruse, see what type of opportunities are out there, types of experiences that are available, you can always go to our website and view the opportunities newsletter that we send out. We also do one-on-one advising appointments for pre-health students, as well as drop-in advising hours. And we also do host occasionally traveling advising hours where we'll go out into different areas of the campus where students typically are located, whether it's like in the classroom buildings or in places where students gather socially, to make ourselves available and present to students and make sure that they feel comfortable being able to come to us. All first-year students who are interested in going into a health profession, no matter what that health profession might be, are required to attend Pre-Health 101 in order to be able to make an advising appointment. We host a number of Pre-Health 101s throughout the fall and spring semesters. So there will be plenty of opportunities to be able to attend Pre-Health 101. We host them both in person and virtually, so you'll have your options, and you'll receive a welcome email closer to the start of classes where we welcome you to the university pre-health advising, and also the opportunity to be able to register for Pre-Health 101. We also offer specific workshops on MD, PhD, osteopathic medicine, dental specific workshops so that students can have a better idea of what it means to be able to go into those areas as well. Uh, Once you move into the reflection piece, you've usually done a bit of the exploration piece, most namely having attended Pre-Health 101. And in that reflection piece, we offer opportunities for you to do just that, to think about the experiences that you've had, to be intentional about the experiences that you want to have in the future, and how those have helped you to build different competencies that medical schools and other health profession programs are looking for you to have developed over your time, from the time that you are in college to the time that you are in the application phase, as not all applicants apply at the same time. Some applicants apply in their junior year, some apply in their senior year, some apply as alumni. So wherever you are in that process, thinking about the activities and things like that that you have done, it's really helpful to do these reflection pieces throughout your time. And so we do offer options for you to be able to do that with us, as well as options for you to be able to do that on your own. We offer a Pre-Health 201, which delves a bit deeper into developing yourself as a compelling applicant to health professions programs. We also offer a course over intercession that aims to help you connect your different experiences that you've had, and really think about why you've done them and what you've gotten out of those experiences. We also offer opportunities to work with you on your personal statement through workshop and through feedback. And then we also partner with a few of our campus partners, Life Design Labs, and as well as the Pre-Health Academy, which offers different opportunities for this reflection process through workshopping and also through an academic course, if that's your preference. Once you get to the application stage, we talk about your readiness for applying, thinking about all of the experiences that you've had. We also currently offer we do have a committee process where we give an additional letter of support from our office, in addition to the letters of support that come from your instructors, from physicians that you may have worked with, from research mentors, etc. And the HPA is our health professions application. That's our internal application that we do, that you will have the opportunity to do as part of the committee process that will also get you prepared to submit your actual application to health professions programs. We also offer applicant-specific workshops, much like with our law students, that focus on different aspects of being ready for the application. So thinking about like your experiences, your preparing for your personal statement, thinking about the different aspects of the application that need to come together in order for you to be ready to apply. We also host both in-person and virtual admissions visits from the medical schools. So that happens every year, and you're more than welcome to start to attend those admissions visits as early as you would like. But most likely, most applicants begin that process in their junior or senior year and thinking about more specific schools. So if you haven't started thinking about that yet, you're nowhere near being behind anything, but these options are available to you for the virtual admissions visits and learning about the medical schools as early as you would like. We also, when you're in the application process, support you with mock interview practice, and all of these services are available to you as a current student and as an alum. Okay, so I've talked about these different pieces of the application offering opportunities for reflection and things of that nature. And the opportunities for reflection are based in these different areas. So health profession schools are looking to evaluate these different areas of your application. So your academic achievement, which are the courses that you've taken, the completion of any prerequisite courses for the schools that you're applying to, that all goes in your academic achievement, as well as the standardized tests that are required for whatever program you're applying to. So if that's medical school, that's the MCAT. If that's dental school, that's the dental admissions test, the DAT, and so on and so forth, depending on the types of schools that you're applying to. They also want to see that you've had some research experience. I think that with the research experience, it really depends on your level of engagement in research, like how much you actually want to engage in research and how much you want that to be part of your continuing education into the health profession. So everyone's research experience looks a little bit different, and that can range from wet lab research to computational, to dry lab, to clinical types of research, to social science research, public health. It really all depends on the type of research that you're interested in. And the amount of time that you spend in that research really is also dependent on your interest in it. Clinical experience is something that you have to have in order to apply to health professions schools. This can look different depending on the types of health professions that you're interested in. You want to get the experience typically in the area that you want to go into. So what I mean by that is that if you're interested in dentistry, then you want to have experience in a clinical setting, in a dental clinical setting. If you are interested in going to medical school, regardless of what specialty you might be interested in now, that you really just want to be in a setting where healthcare is being provided by physicians. And this extends beyond just shadowing. So that's observing the physician. If you're interested in physician's assistant programs, that would be observing a physician assistant. These clinical experiences go beyond just that observational piece, which is also important and that you will have experience in, but it goes beyond that in you interacting with the patients. So that doesn't look like you performing clinical procedures or anything like that you're not qualified to do, but it does look like having conversations and being able to draw from the experiences that you've had and listening to these patient stories to be able to better understand what it means to be a healthcare provider, to be a physician, and what it means to be a patient and working with patients and the things that you keep in mind when you're working with them. Community service is also an important aspect of the application, and this goes beyond the clinical experience. So some of your clinical experiences may be volunteering, some of them may be paid experiences, as those are both options. Community service goes beyond that clinical setting and really delves into how you've given back to the communities that you are part of. So at Hopkins, that can mean the community outside of the campus, so the greater Baltimore community. That can also mean community service in your hometowns as well. Any additional experiences that you may have are also different ways that you can build on different competencies that the medical schools, health profession schools are looking to evaluate. So your ability to work with others, like your teamwork, your communication skills, your reliability and your dependability, your ethical, responsible decision making. Those can come from sharing of experiences that you may have had as a student athlete, as someone volunteering in one of these community service initiatives, as a part of a student group. You may have leadership experiences as part of a student group. So all of those additional experiences are things that you will talk about in your application as well. And then you'll also have to provide letters of recommendation, and these letters of recommendation will come from instructors, from your instructors, professors, your research mentors. They can come from your clinical experiences, so someone who has supervised you in that regard. But those letters of recommendation are also a core piece of your of building a successful application. So things that you should be considering. So applicants to medical school must have medically relevant experiences and community service. So those are two things that that I just talked about in the previous slides, and they are definitely essential to your application. What that looks like for you definitely varies by the applicant and by the student, and those are the types of conversations that we can have in a pre-health advising appointment. Questions about what types of community service you want to become involved in, what types of experiences that you want to have, looking at the things that you've done, what might be helpful for you. These are the types of conversations that we can have in advising appointments. So first year students, really, you should take some time to adjust academically. You want to explore getting involved, but don't overcommit as a first year student. You want to really be able to establish yourself and identify the resources that are going to help you to be a successful student during your time here. So medical schools and other health professions programs really value quality and commitment to activities. So you don't want to overburden yourself with too many activities, but be strategic about the time that you have available and when you can do certain things. And although they do value commitment to activities, there are times where you absolutely cannot do everything all at one time, right? And so you have to spread that out over your time. Um, between now and whenever it is that you apply to a health profession school. And that's something that we can also help you with, and we can discuss in advising meetings. You should major in a subject of interest. There is no one subject that will, or one major that is better than the others in terms of going into medical school. Everyone has to complete the same prerequisite requirements, which are a biology course, a year of biology course and lab, chemistry courses, organic chemistry, physics. These types of requirements are available on our website if you're interested in learning more about them, but all students, regardless of what their major is, have to complete these prerequisite courses that are generally required by most medical schools, and you can complete that with any major. So you want to apply to medical school when you are a strong and compelling applicant, and this may mean taking a gap or bridge years in between. It may mean going straight through, and that means applying in your junior year. Whatever is the right time for you is the best time for you. So we work with students all the way through their first year at Hopkins, all the way through the time that which they wish to apply as alumni. So it really is about taking the time that you need to build a successful application. So what does that mean? It means use your resources. So we have lots of resources available at Hopkins. We are just one of the many resources. Identifying which resources are best for you and utilizing them, like the support services that are available through academic support that can help you adjust in your classes. And also, I think throughout your time here, that's just one of the many resources that are available. And I think that it can be sometimes hard to identify which resource might be best. So you can always start with the one that's most comfortable for you, whether that's us or your academic advisor, to start that conversation about what resources will be most helpful to you with what you would like to accomplish. And the average age of the first year medical student is 24. I often have the conversation with students that they feel behind, that everyone is doing everything a lot faster than they're doing. And that's really not the case, but often students feel that way. So we just share that the average age of the first year medical student is 24, just to give you a sense of when people are applying to medical school, and that they're applying really when they are most ready, regardless of their age. So self-awareness and understanding and communicating your why is essential through this process. And that's why the reflection piece is so critical. And we offer opportunities for you to be able to participate in that reflection. So as much as you can, think about the things that you're doing and why you're doing them. We can help you to be able to communicate that. And those are certainly conversations we can have in our advising appointment, but it is really an important piece of your application when you get to that step. So things that you want to consider, time to pursue, maybe graduate school. Some people who want to go into the medical professions also want to pursue another degree beforehand, or would or need to pursue another degree beforehand. And so some may spend time in graduate school. They may spend time conducting research or being part of service programs or engaging in clinical work. We've had lots of students participate in national fellowship programs or go into industry before applying to medical school. So really, your path and your journey is your own, and we're here to help and support you through that. So next steps as a pre-health student. You can view the pre-health newsletter again on our website. So if you want to peruse some of those opportunities, you absolutely can do that. You can also follow us on social media. We do interact with a lot of students and put really, I think, helpful information on our social media. So please feel free if you would like to follow us to do so. Attend Pre-Health 101 when those dates become available in August. You'll want to register for that and then attend. Again, we offer Pre-Health 101 throughout the fall and spring semester over 10 times. And we offer them both virtually and in person. So you should be able to find one that works well with your schedule and to be able to attend. Visit the Pre-Professional Advising website. We have a plethora of information on there that I think is really helpful. We also have a guide one for pre-med and pre-health planning at Johns Hopkins University. So if you are a first-year student and you're thinking about like, what courses do I need to take? I mentioned some of those prerequisite courses. We have that all in guide one, where we talk about the prerequisite courses that you could potentially take, and things that you need to consider and think about as a first-year student interested in pre-health. So with that all being said, I want to say a huge thank you to you all for joining us tonight, and I will take any questions that I can answer tonight.
Thank you so much, Davina. We really enjoyed hearing all that. We have a few questions in the chat that I'm gonna say to you. So our first question is, when is Pre-Health 101 offered?
So Pre-Health 101 begins at the beginning of September, and we offer it throughout the fall and spring semester. So it'll be held once a week throughout the fall semester, so that's September through December, with both a virtual and an in-person option.
Thank you. Is
Welcome.
pre-health advising connected to JUMP? And if not, do you recommend getting involved with JUMP?
So JUMP is its own separate entity, and I think that if you are interested in working with underserved populations in medicine, then JUMP can absolutely be an option for you. And JUMP does do its own application process and have its own criteria and to be able to participate. So once you're here at Hopkins, I would definitely advise that you connect with the office. When you're here on campus, there will be a number of times where there will be opportunities for you to be able to connect with these different resources. And so once you're here, I do advise you to connect with them if you're interested in JUMP.
Can I use my AP credits for pre-med course requirements, including the lab requirement?
You can use them, but I do think that that's a larger conversation, that is best for an advising appointment because not all schools are going to always accept every AP credit for all of the prerequisite courses that you have to take. So it's really best if you're going to use some of those for certain courses, if you're going to use those AP credits to also take to take an upper level in that particular category. So let's just say, for instance, you have AP credits in biology. That's often when we get questions about. You can use those AP credits if they're coming in to fulfill that biology requirement, but I would also advise that you take an upper level college level course in addition to that. But again, that is really individualized, and that's something that we can absolutely talk about in an advising appointment.
Thank you. Our next question is there a committee that needs to approve our application before we can submit? And if so, is there a limit on how many students the committee provides a letter for?
No, there is no limit. This summer we have provided support and letters for over 450 applicants, which is a lot for our office to support, but we do provide that support. We don't have a cutoff in terms of numbers. We also don't have a cutoff in terms of GPA or MCAT score or anything like that. But when you do enter into the committee process, that does give us the opportunity to have increased contact with you to help you to understand your overall preparedness and readiness. Part of our job as advisors are having those conversations about the things that you have engaged in, about what your application looks like, and being realistic with you about your application at the time of which you would like to apply. So we do have those conversations, but we do not have any cutoffs or ever have a point where we're not supporting a student through the process because of any of that criteria.
Thank you. Our next question is, can you give some examples of clinical experience beyond shadowing for undergrad pre-meds?
Sure. So we have a lot of our students volunteer in different or get experience in different areas like EMT work. I will say that that one is one of the more challenging ones. And depending on what your personality is like, EMT work in that fast-paced environment, working with different types of patients can give you really excellent clinical experience, but it is taxing on time. So that's something to think about. Other ways that students have gotten experiences in the volunteering, I would say through volunteering, a lot of our students will volunteer with programs like Child Life, where they're companions for children with chronic illnesses in the hospital. Some of our applicants will volunteer as medical transport within the hospital or clinical setting, or patient navigators, where they help patients to essentially navigate the different services and things like that in the hospital. We also have people do volunteer work through education services. So like, for instance, working with bariatric patients pre and post-op on different aspects of their nutrition and working with them on that educational piece. A lot of times our alum who are working full-time will get clinical experience by working as a medical assistant in a private or in a private practice, or in some sort of technical role within the hospital setting. A lot of them also engage in clinical research, where they're doing a bit of the working with patients to recruit them for clinical studies, and performing the duties as assigned to that particular study. So those are just some examples outside of shadowing that you gain clinical experience, direct patient care experience.
Thank you. Related to that, would you recommend getting certified as any of these positions, such as a CNA or an EMT?
We certainly do have students who do that because they find that most beneficial to the type of work or experience that they want to gain, but by no means is it necessary in order to be able to gain experience. But if you have the opportunity to do so and you would like to, I think that's a great opportunity.
Um, if I wanted to go into a specific medical specialty, do I have to find clinical work in that specialty?
No, medical schools do not expect for you to have any experience in any particular specialty. They're really looking for you to be able to to have experiences in these clinical settings that will help you to better understand the environment that you're looking to enter into. They don't want the first time that you're meeting with sick people or dealing with people who are not at their best, really vulnerable populations for that first time to be in medical school. So that's really what they're looking for you to gain out of your clinical experiences. It doesn't have to be in any particular specialty. However, if there's something that you would like to explore and you have the opportunity to do that, you're more than welcome to.
What percentage of Hopkins pre-med students have to take a gap year before applying to medical school?
I don't think that they have to take a gap year. I would gonna take that language out of it, but those who do select to take a gap year, it's close to 80% of the applicants that choose to take at least one gap year, which means that they are submitting an application to medical schools right after they graduate, so right after they finish their senior year.
Does the Hopkins Medical School tend to favor their own undergrads?
No, they do not favor their own undergrads, although we do work closely with them in creating opportunities for those for growth to help them be ready for the application process. So, like clinical experiences, professional development opportunities. And this year, they did admit the largest class. The largest amount of students from Hopkins into this class, but there is no favoritism or spots reserved at the medical school for Hopkins undergrads.
Is there a deadline for deciding whether or not you want to do pre-health or pre-med or pre-law?
No, there's no deadline for deciding, but I do think that you want to keep in mind when you might want to go into one of the professional schools. So starting the conversation early can't hurt. But there's no deadline on deciding when you would like to apply. However, because there's so much that's involved, especially in applying to health professions programs, you're often making that decision years prior to actually submitting the application.
What percentage of Hopkins students get into med school on their first application cycle?
So in their first application cycle this past year, I believe the exact number was 79.3% of our applicants were admitted to medical school on their first go around, which is a large majority. If you look at the national average, it's around 44%.
Related to a previous question, does Hopkins give support to getting certifications such as the MA or CNA?
We do advertise those types of opportunities when they are available in the newsletter, but our office does not specifically provide those opportunities.
If I wanted to do medical research as a career, would you recommend going through med school?
So if you are looking to do medical research in that you're looking to pursue an MD PhD, then yes. And that's typically where most of our students end up who want to do some type of research within medicine, but that's not the only way to be able to do that. I think that it depends on what type of research you want to do within that, because there are also master's level types of programs that offer you opportunities to be able to do research within the medical sphere. So I think that just depends on where you would like to go with your research, but we are absolutely a place that you can start to have that conversation.
What kind of help does the pre-professional office provide to students to get involved with volunteering or working at hospitals nearby?
So we promote any of the opportunities that come our way through the opportunities newsletter. Each one of the hospitals and types of clinical settings all have their own process in hiring essentially or volunteers or paid positions. So there's always a background check or process that you have to go through with that particular institution. So we send it out through the opportunities newsletter, as well as listing the opportunities that students are participating in currently that we know are available on our website as well.
Is it good to get involved in clubs other than pre-health clubs? And if
Yeah.
so, would it
Oh,
be,
sorry. Go ahead.
sorry, if
No, you're
so, would it be good to put on my medical application?
So yes, it's good to explore your interests. What you're looking to do is really develop as a person. So that does mean exploring interests outside of your health related interests. And I think that like what looks good on an application is really you presenting your authentic self and being genuine in why you've chosen to explore different things. So we certainly do have a lot of applicants talk about their athletic pursuits, whether that's at a varsity level or just an intramural level, their personal pursuits, cooking, reading, illustrating, all of those different types of things, musical instruments that they like to that they play. So all of that is relevant because really, as an applicant, what you're presenting is yourself.
Thank you. How many research, clinical, and service hours are recommended for applying to medical school?
So there's no set amount of hours. It really is about what you've taken from the experience itself. I will say that most people are not successful through the process if you have less than 200 clinical hours because you really haven't given yourself the opportunity to be able to engage with patients and really spend a lot of time in those clinical settings. However, there is no magic number. It really is about how you can present and talk about those experiences and why they were meaningful to you.
Are there a good amount of resources for pre-dental students? And what do those look like?
Yes, our resources for pre-dental students are very much in line with the ones for medical, applying to medical school. There really isn't that much difference between the two applications. Dental students do have a couple of more courses that some programs may require for them to take that are outside of those that medical students are taking, but we do have those individual conversations with them. It's typically an anatomy and physiology course that's required. That's not required of medical students, but all of the experiences, clinical research, community service, all still apply to dental students. And then we also do hold specific admissions types of programs and presentations and things like that, specifically for dental students from the dental schools.
Does Hopkins provide transportation or funding for students to visit other schools, such as dental or medical schools?
So currently, no, we do not provide additional funding for those types of opportunities. I do know that there are opportunities, like not through our office, but through Hopkins to be able to secure funding for things that are not always paid opportunities through some of our campus partners. So those resources are available, but we do not provide them directly to any students through our office. However, those are things that we are looking to explore in the future as they are often conversations with students about being able to get to certain sites and things like that. So it is something that is on our radar and that we are looking to see what types of support we can offer students. But to be honest with you, at this moment, they do not exist in our office.
Are there any Baltimore EMS organizations that allow full-time JHU students to work part-time, such as a few shifts per week?
So yes, there are several different opportunities to do EMT work in the Baltimore area through the fire department and also through Hopkins. itself. So you can do that type of EMT work. Now, the part-time shifts, I know that like you have to be on call for a certain amount of hours in order to be able to participate as an EMT. So I can't speak specifically on like what that part-time would look like, but typically you have a shift where you're on call for 24 hours within a certain amount of time within that month.
Related to that, do you think it's feasible for students to do this during the school year?
Yes, I do think that depending on how comfortable you are with your schedule, how well you've adjusted to your coursework, what other types of commitments that you have, that can be a commitment. For those that it cannot be a commitment during that time, because for example, it's often really hard for student athletes to be able to make that commitment because of their schedule with practice and with traveling to games. So a lot of their experiences take place over the summer, and medical schools understand that because they have this commitment, large commitment during the school year. So yes, it's possible, but it really all just depends on the time that you have available.
Do medical schools tend to prefer students with a more liberal arts undergrad education or STEM-based?
I don't think they have a preference for either. I think their preference is for students who have really, or applicants who really developed the competencies that they're looking for. And all of these competencies that I'm referring to, you can find on the double AMC, that's AAMC.org. That is the essentially the Association of American Medical Colleges. So a lot of the guidelines that we have come from this organization that really looks to streamline this process and to also offer different resources for students to be able to develop. One of those resources is looking at the competencies. So again, that's aamc.org, and you'll see the pre-med competencies where they want you to be able to develop things like communication skills, your ability to work with other people, your scientific inquiry. There are a list of all of these different competencies that you'll gain from experiences. So that really is, they're also looking for you to be able to develop that through your academic pursuits. So there's no preference really on what you choose to pursue, as everyone has to do those prerequisite courses to show essentially your competency in the sciences. But outside of that, different types of majors can give you a variety of skills. So if you're like computer science and you're really looking at big data, like that has definitely transferable skills and is applicable to things that you will do within healthcare. If you are someone who's majoring in English, certainly writing and communication are huge pieces of that, right? So there's something I think to be taken from any type of major that you choose to pursue, and medical schools do not have a preference for whether or not you're STEM or not. I will say the majority of students tend to major in STEM because that's where their interest lies. But they have no greater opportunity of being accepted to medical school than someone who did not.
Would you recommend hiring a private MD consultant?
I mean, that's really up to that. I think that's really up to you as an applicant. We certainly do provide all of the same services that a private consultant would provide, but it ultimately is your application. So if you would like to do that, that's completely up to you. I do think that we try to offer all of these resources at Hopkins to maintain equity between students, as we do know that some students have the ability to be able to afford things like a private consultant and other students do not.
Where do I find the sign up for Pre-Health 101?
So Pre-Health 101 will become available to you the week prior to school beginning. You'll receive a welcome email from the Pre-Health office, and this will include a lot of the things that I've talked about today, as well as the sign up for Pre-Health 101.
Does Hopkins have an EMT certification programs or connections with hospice care facilities?
Yes, so we do have students volunteering in hospice care. There are quite a few facilities that are in the general area around campus. Their students volunteer, and there also is an EMT service through Hopkins. That's a student-led program, and they do the also certification through that. Any other types of certification, if it becomes available, we do send that out through the Opportunities newsletter.
What if I'm torn between different career choices? How do I know if pre-health or pre-law is for me?
So gaining experience is a really great way to be able to do that. So I would say with pre-health, starting to get a shadowing experience because it's not you don't have to give as much of a time commitment to a shadowing experience as you do sometimes with direct patient care experience where you're the volunteer and they're expecting you to be there every week. A shadowing experience can last a week over the summer or during intercession winter break where you can get a better sense about whether or not this is something that you want to enter into. We also have a YouTube page from our office as well, where you can view some of the videos that we have through some of the workshops that we've had with both health profession schools across the board, so medical, dental, osteopathic medicine schools, as well as MD, and with our alum. And that can also give you a better sense of like the path and what it takes in order to be able to go to go onto this next step into medical school or into law school. But I definitely think that starting with experience, a low level commitment experience like shadowing a physician or a lawyer is helpful, or having a chat with an alum about their career path and like what they're doing. And you can connect with the alum through the one of the mentoring programs here at Hopkins.
All right, we're approaching the end of the time, so this is our last question. How often do I have to meet with my pre-professional advisor in my undergraduate career?
So you don't have to meet with us any amount of time. This is pre-health advising is absolutely optional, but a really great support resource. So we do recommend meeting with us at least once a year. I think it's helpful to just be able to check in, but you are under no means are you obligated to meet with us. But I highly recommend that you do.
All right. Thank you to Davina for joining us tonight and for sharing your insight. We appreciate everyone who took the time to be here. A copy of this recording will be available in a few days on our website in the same location where you registered for it tonight. One final note before we leave. Your student will begin the required new student orientation program at 6:30 on August 17th, which continues until classes start on Monday, August 25th. Your student will likely not be able to physically reconnect with you at this time, so we ask that families do not plan to stay in Baltimore during the orientation week. Our next and last Hop on Board Families webinar will take place on Wednesday, August 6th at 7 p.m., covering move-in day expectations. Registration is available on our website. And just as a reminder, if there are any questions we weren't able to get to, feel free to email the pre-professional advising office or us at firstyears@jhu.edu. And one final thing, Davina, do you have any final pieces of advice for us?
Yes, I think have fun. This is a really great and exciting time in your life if you're here in this room as a student. And if you're a parent, please encourage your student to have fun and to be able and to also take some time for themselves to adjust, to find their community. And I think that those if you build a solid foundation, you will be on your road to success here at Hopkins and in the future with whatever types of programs you choose to go into. Thank you.
Thanks so much, Davina, and thank you all for being here. We'll look forward to seeing you in a few weeks' time.
Have a good night.
Have a good night.